This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly news update, coming to you from the Health Broadcasting Service HBS radio channel. China allows COVID boosters of different technologies than primary shots. China is giving COVID-19 booster vaccines using technologies different from the initial injections in an effort to improve immunization strategies amid concerns that its most used jabs appear to be weaker against variants such as Omicron. Boosting population immunity could be crucial to preparing China to eventually reopen its borders and pivot from its dynamic zero strategy, which involves travel curbs and mass testing following dozens of local infections. Experts are watching whether combined Chinese doses would lead to higher effectiveness. Adults injected with a vaccine developed by Sinopharm, or Sinovac, at least 6 months earlier can now receive their booster doses with the vaccines using different technologies, produced by CanSino Biologics, or unit of Chongqing Zhifei Biological Products, National Health Commission official Wu Liangyu said on Saturday. Around 1/3 of China's 1.4 billion people had received boosters using vaccines of the same technologies as their primary doses as of February 7. Data showed that boosters of either the same or different technologies as primary vaccinations can improve immunity, Wu told a news briefing. He did not contrast the two approaches. A small sample Hong Kong research showed that Sinovac's CoronaVac shot, boosted with a third dose about 2 to 5 months after the second, failed to produce neutralizing antibody responses to Omicron in most recipients. The Sinovac booster-triggered antibody response was also weaker against Delta than a CanSino Bio booster in a clinical trial. Tested against Omicron in a Chinese study, a third BBIBP-CoV shot produced by Sinopharm elicited lower antibody level than a booster of Zhifei's vaccine in those who already received 2 BBIBP-CoV shot. Among close contacts of infected people in an earlier Omicron outbreak in Chinese cities of Tianjin and Anyang, receiving a booster reduced Omicron breakthrough infection rate more than threefold compared with the primary vaccination, said Xiao Yiming, who is on an expert team for China's COVID vaccine development work group, at Saturday's news briefing. Xiao did not provide complete data or specify which boosters were analyzed for the readings. Products from Sinopharm and Sinovac approved in China are inactivated vaccines that contain inactivated or killed coronavirus. Zhifei's vaccine contains parts of the coronavirus protein, while the CanSino Bio shot uses a modified human cold virus to ferry genetic material from the coronavirus protein. In a second report analysis, Hong Kong's zero-COVID success now worsens strains of Omicron spike. Hong Kong until recently had an enviable record battling COVID-19, but as an Omicron wave now overwhelms the city, the steps that saved lives are making life unbearable for many of its 7.4 million people. Like an immune system overreacting and harming the person it is meant to protect, the dynamic zero-COVID policies that had crushed the virus in Hong Kong have contributed to current woes, experts say. Patients lie in beds in cold, wet parking lots outside overflowing hospitals, isolation facilities are filling up and thousands queue for hours outside testing venues. A 60-fold spike in daily infections this month prompted the government recently to modify its COVID eradication policies, but the authorities continue aiming to wipe out the virus. The impact of zero tolerance will remain for some time, epidemiologists say. Hong Kong's strict pandemic policies have limited coronavirus infections to around 40,000 with 259 deaths, far fewer than in other major cities. Asian rival Singapore, with 5.7 million people, has reported more than 500,000 cases and some 900 deaths. Under zero COVID, Hong Kong authorities essentially closed the border and hospitalized even asymptomatic coronavirus-positive people and isolated close contacts with infected people. A person showing little or no symptoms could spend weeks in hospital, then move to an isolation facility for several more weeks before being allowed to return to normal life. In return, most people in the global financial hub could go about their work and social lives with few restrictions. The government leader, Chief Executive Carrie Lam, has said Hong Kong cannot surrender to the virus and that containing the outbreak is now of paramount importance, as she seeks the people's understanding for inconveniences caused by the policies. Elimination was initially the best strategy for Hong Kong, but is no longer appropriate, said Dr. David Owens, a founding partner of OT&P Clinic. Once effective vaccinations became available, the negative framing and policy around zero COVID adversely impacted vaccination rates, especially in the vulnerable, he said. The messaging was not only unscientific, it paradoxically increased the risk to population health. The government did not respond to a request for comment on whether its zero COVID policy had contributed to the current problem. As the highly transmissible COVID variant tests the healthcare system and public patients, the authorities have made a subtle transition from elimination to mitigation, adjusting policies frequently, based on the severity of symptoms and availability of beds and isolation rooms. Asymptomatic carriers may now go to quarantine facilities, or even home, and close contacts may isolate at home. Insane and cruel. But the healthcare system is stretched to breaking as infections soar. Plans for mass testing from next month will likely be ineffective, some epidemiologists say, without a full mainland-style city lockdown, something Lam has ruled out. Zero COVID can't last forever, said Peter Kalinen, Professor of Microbiology at the Australian National University. Sticking to the goal can lead to poor resource allocation and priorities. Tracing, testing, treatment and quarantine resources still target every infection, instead of prioritizing high-risk groups, such as the elderly, causing widespread frustration. Zero COVID messaging, some epidemiologists fear, may encourage complacency and false hopes among the largely unvaccinated elderly that the city may again become virus-free and stay that way. More than 60% of residents over age 80 have not been vaccinated, although some 85% of the entire population has had at least one shot. Bars, gyms and beauty salons are shut, many unable to stay afloat. Around 900,000 students are out of school, while most people have resumed working from home, reminiscent of early 2020. The economy is likely to contract this year after last year's rebound from the city's longest recession, some analysts say. And the isolation and economic uncertainty threaten a mental health epidemic, psychologists say. It's insane and cruel, said a 41-year-old resident whose family went through 5 weeks of hospital and government quarantine, including separation from their 2 toddlers. Nowhere else in the world is doing this. Hong Kong has asked Beijing for help. More than 100 million rapid tests are on the way from the mainland, and the authorities plan to boost testing, build more isolation facilities, and ensure food supplies after vegetable shortages this month. But some health experts forecast daily infections rocketing to as much as 30,000 by the end of March from 3,629 on Friday, far outpacing efforts to increase capacity. Epidemiologists at the University of Hong Kong have warned that only a costly, months-long, full lockdown would eliminate infections. And while that would return the city to where it was in December, Omicron could strike again, causing renewed chaos, they say. Residents, who at the start of the pandemic went beyond government recommendations to keep their friends and family safe, have started to lose faith. The government wants to achieve dynamic zero COVID, which has basically made citizens more troubled and confused, because I believe that no virus can be eradicated completely, said 39-year-old Hang Tang. Connect with us on our Facebook platform, at Health Broadcast, and our website, at www.healthbroadcastingservice.com. And please remember to press the subscribe button to stay abreast of vital and authentic health developments from around the globe, delivered to you by the Health Broadcasting Service on YouTube channel. We will bring you more updates as more reports come in. Stay safe and remain healthy.
You've been watching the Health Broadcasting Service YouTube channel, your channel of excellence and distinction. Pioneering specialist radio broadcasting, giving you the best experience. Subscribe to our channel